Hope you're doing good. So we are almost at the end phase of this oral surgery, and I hope most of you have developed good passion and love towards this particular subject. So now in this topic, I'm going to discuss about osteomyelitis, osteoradionecrosis, their diagnosis part, and the treatment part. So before going into this topic, there is one important aspect that I need to discuss with you. Most of you feel lazy at one point. Most of you feel irresponsible at one point. Not able to focus, not able to complete the task, not able to sit for longer duration of time, not able to do things as you expected or as per our tasks. So this is a most common complaint that I regularly go through from years to years. Your seniors, your super seniors, even when I was preparing, I used to do the same. And after going all these questions, after going through all these questions and all these people, talking with many people, so I came to a conclusion that most of these things are illusions. Okay, so for example, if you take a person, okay, a mother who is having one or two kids, who is having some responsibilities, who need to take care of is their in-laws, who need to take care of their husband, who need to take care of their clinic, if a clinic is there, or working area where she is working. So she has so many responsibilities. Okay, so in these responsibilities, I ask, is there any day where you are starving? The question is yes. Is there any day you made your children to starve? The answer for this question is no, never. Okay. So by this, I came to a conclusion that it is all about the priority. Okay. So when compared to your health, you give more priority to the children. We never keep our child or we never keep our kids to starve in the home, but we starve regularly, like because of the work or because of some XYZ. Why? The reason is the priority is more towards the health of a kid when compared to the health of us. Similarly, there are areas where we give less priority. For example, most of you were not able to finish the things on time, and the reason is laziness, not able to interest, not able to focus. Right? So this is the reason. But I can ask you one question. Are you eating food every day? Are you sleeping every day? The answer for this for most of the students is yes. Why are you doing? They are a basic requirements. They are the basic requirements that we are following. Why we are not able to do the things or finish the task on the time or in the time is, this is not our priority. I can give a simple dental example. Okay, so most of the professors and the teachers, including my HOD, they used to keep a deadline. They used to keep a deadline before which your works has to be submitted. But this deadline will be hit by only 5% of crowd out of 95. Rest of the 95 people fail in reaching this deadline. Reason? It's not that important. Who is going to kill you if you don't complete the things within the deadline time? But if you take the submission of your work to get permission for your final year exam, or submission of the work to relieve you for the preparation of final year exams, or submission of work to clear the exam, 95% of the people clear it, but only 5% leave about that 5%. Here 95% of the people will clear that. Why? It is mandatory. It has priority. It is the first priority, because if you don't do the things on time at this particular point, you will be failed. You are not permitted to give exam. You have to sit for 6 more months. That fear factor and that deadline is, you're going to take it very seriously into consideration. Same scenario. Now you have 7 months for the preparation, or now you have some X months for the preparation. Right? If I'm talking about this 2 months or 1 month before the preparation, 2 months or 1 month before the preparation. No one is going to tell you that I'm lazy, I'm not able to do this, I'm not interested. No one is going to give such complaints because it is a deadline. You have your priority as an exam. But now most of you find some silly reasons to come out with your ill performance. So it's all about your priority, your seriousness that is most important in preparation rather than anything. People who have seriousness, people who has punctuality, people who do things on time will definitely have high chances of winning rate. Not only in the entrance, but throughout your life. People who stand on their words, people who committed to their goals will have high chances of their success rate in their professional life as well as in the personal life. Don't ever give an explanation for your ill fitness or for your incapability. Always try to find some good reasons to make you better day by day. So this is the main aspect that I want to discuss with you before I start, because nowadays I'm hearing lots of messages coming from the students not able to do this, I'm feeling sleepy, I'm feeling headache, I'm irritated. All these things are just reasons. Just a reason. It's not a cure. It's not a cure for your disease. So always find a solution or find a cure for your disease. Don't give reasons. Okay. So that's all for this particular aspect, and now I'm going to start the discussion. So I just want to focus more on the definition because definition was asked several times. Okay, it is defined as inflammation of the medullary space. Okay, so the medullary portion of the bone. Okay, it is defined as an infection of the medullary portion of the bone. This medullary is important. It's asked as a question. So there may be some case connected questions as in the recent AIIMS and NEET. Okay, so basing upon the predisposing factors, you can predict that there is some sort of bony necrosis or avascular necrosis of the bone, a common term that is regularly heard in the case of your sickle cell anemia. Necrosis of the bone without any underlying cause is a common. Avascular necrosis of the bone is seen in the case of sickle cell anemia. So apart from this, there are many other reasons. Okay, trauma, road traffic accidents, gunshot injuries, radiation damage, that is osteoradionecrosis, are known things, are etiogenic things. Whereas coming to all these aspects of the compromised bone formation, that is Paget's disease, your osteoporosis, osteopetrosis, fibrous dysplasia. Anyway, we are going to learn all these aspects individually in your oral radiology and medicine. But all these are predisposing factors for the necrosis or the inflammation of the bone. So coming to the few systemic factors which again has an influence, that is malnutrition, no proper food, acute leukemia related with the blood, okay, uncontrolled diabetes, sickle cell anemia, some autoimmune diseases, some AIDS. All these are some predisposing factors for the occurrence of osteomyelitis. So coming to this is again a most commonly asked question. Okay, the occurrence of this particular disease is more in the mandible when compared with the maxilla, and the reason is mandible will have less blood supply when compared to the maxilla. Mandible will have thick cortical plates when compared with the maxilla, and it has dense medullary tissues which leads to the occurrence of infection within the bone. Okay, so all these are the reasons why the mandible has more occurrence when compared with the maxilla. And coming to the mandible, it is most commonly seen in the case of body. This is an order of sequence of occurrence of the osteomyelitis in the case of your mandible. The next goes is some pathogenesis related to the non-suppurative osteomyelitis. So whenever there is acute inflammation, there will be edema, and whenever the edema, all these pathophysiological changes we'll learn in detail in general path. Okay, so how this edema is going to increase the pressure, that is a medullary vascular pressure. So whenever this medullary vascular pressure increases, it's going to keep compression and leads to stenosis and ischemia of the bone and lead to avascular necrosis. And coming to the suppurative osteomyelitis pathogenesis, here you'll have organisms and pus which enters the Haversian system or the nutrient canals, and they lead to the periostitis, that is elevation of periosteum, by which it disturbs the blood supply to that area and cause a vascular infected bone. So all these terms are very, very important. The term 1 is sequestrata, term 2 is involucre, and term 3 is, okay. So all these are important. Easy way to remember, okay. So involucre will have N in it. Coeliacae will have O in it, okay. So N for, simple way, N for newborn, okay. Involucre is a newborn. This is a dead bone, is a necrotic bone. This is O. O means opening. This is an opening in the involucrum from which the pus is going to escape. Very easy to remember the terms. Don't take things complicated. Just remember like this, because questions will be there. You will have 4 options and easy to identify the right answer. So just make a note, as oral microbiology is an important aspect. These are the organisms that are concerned with osteomyelitis of the bone. Just make a note of this. Coming to the classification. So regularly asked question in this classification, which of the following is non-suppurative osteomyelitis? Which of the following is suppurative osteomyelitis is a question. So simply you can select the option. Okay. So here it is acute, chronic. Chronic again divided into primary, secondary and infantile. Whereas non-suppurative osteomyelitis includes the diffuse sclerosing, focal sclerosing, proliferative periostitis, also called as gyrus osteomyelitis, and osteonecrosis. Easy to identify which of the following is suppurative, which of the following is non-suppurative, is a regularly asked question for you. The next comes the clinical aspects of each type. As we have already discussed the few things which are going to come in the acute. So what is acute? So most of the acutes, they have intensive pain. They have intermediate fever, paresthesia of lower lip, and a clear cause can be seen in the acute case because it is after an incident. Subacute. What is subacute? Acute, which after 10 to 14 days, if it is not recovered, is going to convert into subacute. How you to identify the subacute? Subacute will have acute as well as the chronic symptoms. So all the features of acute plus a loosened teeth, which is a chronic symptom, fistula, which is a chronic symptom, pus exudate, chronic, oral odor, chronic. All these are chronic signs. Means a chronic signs plus an acute signs gives an idea that it is in the stage of subacute, which is 10 to 14 days after the onset of the acute infection. The next comes are the chronic. As already discussed, chronic has 3 types. One is primary, one is secondary, and one is infantile. So primary has no history of acute symptoms. No history. Patient cannot give any sort of history of acute symptoms. Whereas secondary chronic, the patient gives a symptoms of acute osteomyelitis or incomplete treated osteomyelitis. Okay, clear? Radiographic features of chronic types, that is both primary and secondary, are same, but if you take infantile, there will be little or no radiographic changes. Same as acute. Acute has no radiographic changes. Similarly, infantile chronic part has no radiographic changes. So we'll focus few on the clinical aspects. Okay, that is, chronic will have mild pain or slight pain, whereas acute will have intensified pain. Chronic, the patient complains of slow increasing in the jaw size, which is not well appreciated in the case of acute. And development of, this is very important point, development of sequestrata without fistula formation is a feature that is seen in the case of primary chronic infection, whereas fistula formation with sequestrata is a sign that is seen in the case of secondary infection. You will have indurated soft tissue, thickening or wooden characteristic feature to the underlying pain on tendon palpation. Whereas infantile is a very peculiar to identify. You will have periorbital cellulitis. Maxilla on the affected side will show swelling both on the buccal and the palatal sides, especially in the case of the molar region. Fistula will be present, fever will be present, convolutions will be present. So these are the features by which you can identify this particular type of osteomyelitis. Followed by coming to the second part, that is non-suppurative osteomyelitis. So the non-suppurative osteomyelitis are these three types. And the last one, that is osteoradionecrosis, we are going to discuss in the later half. So Gary's osteomyelitis, okay, most common in the children and the young individual. It is localized, hard, unilateral, non-tender bony swelling of the mandible and a caries teeth. On radiographic, you can see onion skin appearance. Whereas in the case of chronic focal sclerosing osteomyelitis, is most common again in the young individuals below 20 years. First molar is the most common area, and you will have a well circumcised periapical radio-opaque mass at the root apex. The next one, focal diffuse. Here it is focal, here it is diffuse. Is most common in the case of females, and mild pain and ground glass appearance is the feature. So there are some rare cases of osteomyelitis which can be seen in these conditions: actinomycosis, tuberculosis, syphilic osteomyelitis, nocardia osteomyelitis. Just make a note. Chances are there they can ask questions on this area too. So coming to the treatment aspects. So you have some area where there is some infection or a trauma leading to the inflammation of medullary spaces, leading to the necrosis of bone. So now what treatment you are going to do? First, identify the etiology and the correction of host defense mechanism. So what is the etiology which is causing this particular condition? You have to identify first. Okay, what is the etiology which is causing this particular condition? You have to identify the first. So that is the first important aspect. And coming to the second point, that is, as we have already discussed, there are bacteria which are causing this. So you need to do gram staining and culture sensitivity test to identify this specific bacteria, so that you can use some antibiotics on that specific bacteria, because antibiotic therapy is a modality of treatment for osteomyelitis. So then all these bony swellings are mainly concerned with some bone tumors also. So you need to take some CT scans or some imaging techniques by which you have to rule out that any cause of bony tumor. So you can exclusively work on osteomyelitis. So then give antibiotics which are basing upon your culture sensitivity test. If there is any tooth or loosened tooth or any dead bone, remove it. Okay. So if possible, repeat the cultures and try to modify your antibiotic therapy, that is guided, that is culture guided antibiotic therapy, means you're going to modify it basing upon the culture techniques. So you're going to do repeated cultures and modify the antibiotics. Whenever the antibiotics are not able to reach the particular area, you need to go for the topical application of antibiotics, that is by irrigation drains or by keeping some antibiotic beds. I'm going to show the pics of all this. And followed by the last one is the surgical aspect, that is removal of debridgement, decortication, resection, reconstruction. Reconstruction is again forming. So at last, first you need to try all the conservative methods, and at last you need to go for the surgical mode of approach. So this is how you need to plan the treatment. Treatment, as already discussed, it can be a conservative treatment or a surgical treatment, as I have already discussed with you. So next course. So what are the conservative treatments? The conservative treatments is rest, some supportive treatment by giving proper nutrition supply, rehydration, as there is a pain in all the chronic and acute. In the case of acute, the pain is intensive. In the case of chronic, the pain is mild or dull. You try to give some NSAIDs to control the bone pain, or some opioids to control the bone pain. And followed by blood transfusion. If your RBC and hemoglobin levels are not up to mark, you need to plan for the blood transfusion. Then I was talking about the culture. Once the culture is done, you need to plan antibiotic therapy accordingly. That is, the different modes of antibiotic therapy. Here I have given one or two resume. Okay, so mainly the drug of choice is the penicillin. Make a note. Dosages and all these are not regularly asked in examination point of view, but make a note. An empirical therapy is penicillin V. Okay, so that's penicillin B is most commonly used. And the second one is it is based upon the culture and the sensitivity results. Then you can plan the penicillinase resistance penicillins such as oxacillin, coxacillin, dicoxacillin can be tried. Okay, few cases you can try metronidazole. And the second drug of choice is clindamycin. And goes the third drugs of choices are cephalosporins. And if all these doesn't work properly, then you can think of erythromycin as a fourth drug of choice. These are different modalities, but make sure in most of the cases they may not ask you the dosage of the drug, but it's better just you have a look. If you understand the things, you'll have a more command over this particular area. Coming to I was talking about local antibiotic therapy. The antibiotics are not able to reach the area of the focus systemically, then you need to plan for antibiotic therapy. That is by using a irrigation. That is by using a tube, or you can see some IV bottle. Okay, that you are going to irrigate with this, and you are going to do the suction drainage with this. So you can irrigate with antibiotics, or you can keep directly the imbricated beads of antibiotics, coated antibiotics, directly into the surgical area. The next comes is hyperbaric oxygen therapy. So hyperbaric oxygen therapy is an intermediate, usually daily inhalation of 100% pure or humidified oxygen in pressure which is greater than 1 atmosphere. Mostly it will be 2.4 atmospheric pressure. Okay, 2.4 atmospheric pressure. And each session is 90 minutes. They are called as dives. And each dive is 90 minutes in length. And they are given as 5 days per week, twice a day, with 30 to 60 or more than 60 dives at this pH for about 90 minutes. And they do this in a closed chamber. You can see this closed chamber. This is the high pressure oxygen delivery closed chamber. Some important points that you need to add, or you need to understand, which is related to the physiology of this hyperbaric oxygen therapy. That is, this oxygen therapy is going to stimulate angiogenesis in hypovascular tissues, because the vascularity is disturbed in this, because there is a problem with the medullary space getting infected, and a vascular necrosis occur, drop in the blood supply to the particular area, so we need to increase the angiogenesis. And the second physiological cause is it's going to enhancement of the lysosomal degradation, potential of polymorphonucleosides and free radicals. So whenever you have oxygen free radicals are there, they are more toxic to many anaerobic pathogens. They don't love anaerobes don't love oxygen. So whenever you have oxygen free radicals, the anaerobes will die. So this elevated pressure, I was already talking, it's a closed chamber with high pressure of more than 1 atmosphere, somewhere around 2.4. So at this high pressure, the exotoxins of bacteria are inactivated. And of course, as the oxygen levels are improved, the wound healing capacity of particular trauma will be improved. All these are advantages which are related to the physiology associated with hyperbaric oxygen therapy. And the same reason why in few cases you can use antioxidant therapy. Okay, additional antioxidant supplements or antioxidant therapy can be done to improve the oxygen levels by releasing the free radicals that are going to destroy these microorganisms. Okay, so can also be done. That is antioxidant supplementary therapy can also be used for this case. What is the surgical approach? We are talking like surgical approach is the last approach. Extract the teeth, give a proper incision and drainage so that the pus or anything can be removed off. Sequestrectomy, you can remove that sequestra, or you can shape it, You can remove the cortical plates, or finally you can resect it, remove it, and you can reconstruct it. So these are the different approaches for this particular case. So this is extraction of the etiology. Give an incision and drainage where the pus can be released out. I hope you know the stab incision is given for the incision, and you can use Hilton's method for this incision and drainage where the pus or all the folliculi which are present around the pus can be removed completely. The second one is the removal of this dead necrotic bone. Whatever is dead, try to remove that necrotic bone. And then the shaping the area. Here you can see you have removed it, then you have shaped it. Okay, so removal of the bony hollow cavity, that is the dead space, and create a saucer shaped. Okay, so the saucer shaped should be created. Next one is decortication, that is the removal of the chronically infected cortex of the bone. How the lateral and the inferior borders of the cortex are removed 1 to 2 centimeters beyond the affected area, so the possibility of reoccurrence will be very, very less. Last one is remove it and reconstruct it. You can see the reconstruction. Yesterday someone is asking a question related to the reconstruction. Graft has to be taken. For example, if you talk about the reconstruction of this particular place, particular mandible, this big portion of the mandible, a simple graft is not sufficient. You need to take a graft of a larger size, and the better graft is, of course, autograft, that is taken from the same individual in a different area. So when they're giving an options related to the selection of graft for the reconstruction of the procedures, so always make a note that where you are reconstructing. If you are reconstructing a cleft, that is fine. Cleft lip and cleft palate, if you are reconstructing, that is okay. That maybe a small bone is required, so you can take from any of the area. But when you are reconstructing a larger bone like this, you need to take the graft from an area which is a larger area. You should preferably choose a larger area graft. The next one is osteoradionecrosis. Okay, osteoradionecrosis means radiation patient, there will be necrosis of the bone. Why necrosis of the bone will occur? Because of hypoxia, because of hypocellularity, because of hypovascularity. Around that irradiated area, there will be necrosis of the underlying bone. You can see the necrosis of the underlying bone. Few cases they give a history of some radiation therapy, or the patient gives a history of some radiation therapy in the head and neck, or some treatment of radiation in the head and neck because of some carcinoma, and followed by some related stuff to the bone. Most of the cases it will be osteoradionecrosis. So the types of osteoradionecrosis are divided into type 1, type 2 and type 3. Type 1 is immediately or shortly after radiation. Type 2 is years after radiation, follows a traumatic event. No trauma, but there is an event. Type 3 is spontaneously without a preceding traumatic event. So all these three types are important. Clinical features: asymptomatic in the early stages. The patient complains of ulcerated mucosa. You can see the ulcerated mucosa in the previous slide. You will have a devitalized bone or impacted foot. You can see that too. You can have an impacted foot or devitalized bone. Pain, bone pain, bad smell because of the foot. Sometimes in advanced cases you will have fistula, pathological changes, pus discharge and everything. Okay, we have managements like the same management like what we have discussed for osteomyelitis, that is surgical management. Hyperbaric oxygen therapy can be given for this case. Okay, so the hyperbaric oxygen therapy. Ultrasound therapy can be done to improve the vascularity and cellularity, that is new vascularity, new cellularity. Irrigation of the exposed bone, mechanical removal, placement of medicated packs, and all these things are done similar like your osteomyelitis. Last one, just make a note because these topics were mostly focused or related to the oral path and oral medicine, that is BRONJ. What is this? They'll ask you this simple abbreviation, that is biphosphate related osteoradonecrosis of the bone. So sometimes we use bisphosphates. Okay, so bisphosphate related osteoradonecrosis of the bone can be described as an area of the bone in the jaw which has been dead and exposed in the mouth for more than 8 months in a person who is taking this particular medication. Okay, so all the examples of these bisphosphates and everything we'll be discussing in pharmacology, and other futures we'll be discussing in radiology and medicine. Okay, so for now this is more than sufficient related to this particular oral facial infections of heart tissues. Okay, most of the questions will move around this particular area, and interlinking is very important. For example, I was talking about additional anti-supplementary therapy can be used as a good aid in these cases to improve to kill or improve this outcomes. So in that additional antibiotic therapy, they may correlate it with that of your vitamins. Okay, so vitamins is a part which we learn in biochemistry, right? So when you're talking about vitamins, there are few vitamins which acts as an antioxidants. What are they? A, C, E. Okay, so out of which this ACE can be indirectly useful for this supplementary antioxidant therapy. This interlinking is really required from one subject to other subject. Okay, that is tocopherol. Tocopherol is vitamin E. Vitamin E is again used as an anti-supplement therapy for this treatment also, which is not discussed here, but they can ask questions on such interlinking things also. So this is how you need to think and approach. Okay, so when you see a question in the examination hall, don't decide the question or don't decide the difficulty of the question just by reading the question. For example, they have given some beautiful diagram based stuff and they are asking identify this diagram. On seeing the diagram, you decide that I have never seen this diagram. But that difficult question which you are unknown can be converted into an easy question, if the options are easy. Even a very easy question can be converted into a difficult question by making difficult options. Maybe in that particular diagram, they may give a oral associated picture of that particular instrument. And if you see the options, only one oral related stuff is there, rest all related to the general human body. So by elimination method, you can go for the right answer. So the difficulty of a question is based upon the options. It is not based upon the question. So don't judge the question. Decide the question whether it is easy or difficult, whether it is known or unknown, basing upon the options. And that is the prime reason why I am asking most of you to give all 120 out of 120, all 240 out of 240 questions in the practice papers. In the mocks in the last 1.5 month or 2 months, we will see how to handle the negative marking, how to decide whether you have to go for this particular question or there. All the techniques I'm going to explain you, don't worry. But right now, if it is a daily exam, if it is 20 marks daily exam, give all 20 out of 20. Don't bother about negative marking. Because if you're giving 20 out of 20 means you're attempting even an unknown question. So what your brain is trying to get answer even for an unknown question. But if you start working to leave the negative marking questions right from now, your brain will stop thinking. Power of thinking of your brain will be dropped down, because if you see a question, read a question and decide that I don't know, your brain stops working there. So in the examination hall, it is mandatory that you have to come out with the answers even for an unknown question by using common sense, by using presence of mind, by using a logic. We are not robots, right? We are human brains, and human brain can think at any level. Okay, it is upon the presence of mind that is required. So if you start working on negative marking right now from the day one, your presence of mind will go off. You will not think about any question which is unknown to you. Okay, this particular topic term BRONJ, I have never heard, I don't want anything. You'll go off. Maybe there may be some clue in the options, some information in the options, some information at the corner. It is given as osteoradionecrosis. It's a type of osteoradionecrosis. Okay, you confirm it. Okay. Rest all options are related to osteoradionecrosis. You know osteoradionecrosis, but you don't know BRONG. So this is how you need to apply your brain. Physically, you need to keep some pressure on the brain so that the brain start practicing the things. Similarly, like your the net practice of the cricket matches, or I mean, most of you play sports in your college, right? You'll practice every day. You'll practice 10 days or 14 days before the sports event. You're going to practice. Is every ball that you're going to hit or ball that you're going to kick is a predetermined software in your brain? Means if it comes like this, I'm going to hit like this. If it comes like this, I'm going to hit like this. Or the practice, what you're doing is giving an ability to hit every ball basing upon the situation. So hitting a ball or kicking a ball which is coming in front of you in a sports is a presence of mind. Your brain is going to give a command. It's not a predetermined software that is inculcated in your body or a brain. Similar to your preparation. Most of the students, they go for same percentage of right answers if everything is given from the things which are already exposed. Same question, same options already teached or already done in the pulse or dentist. Yes, 100% is right. Question slight twist, 100% is wrong. Means you are making your preparation in such a way that you are giving some positive feedbacks that if it comes like this only, I will prepare. If it comes anywhere apart from this, I don't want. Are you going to treat a patient basing upon your presence of mind or your knowledge, or basing upon the previous cases what you're exposed? Okay, this teeth, same class 2, 10 years back I have done, now I can do. Any modification in the class 2, I cannot do. So this ideology, you have to apply everywhere, and particularly in the preparation. Mind has to work. You need to apply your brain. Force your brain to apply. Every individual who has brains, okay, we have that application power. That is the difference between a normal human brain and an animal brain. As we are humans, we need to apply the brain basing upon the situation. Now the situation is different, right? You need to start working and apply the brain. So this you have to start including in your daily schedules. Imagine, close your eyes and imagine the case. Okay, yes, osteoradionecrosis. How to differentiate chronic and acute? Oh, these are the features, chronic. Okay, these are the features, acute. Okay, so radiographically, how to differentiate acute and chronic? Yes, done. What are the treatment? Basics, yes. You're going to do the conservative treatment. What are the things under conservative treatment? So antibiotic therapy, what are the choice? Patient is allergic to penicillin, what you need to do? What is second drug, third drug, what is the fourth drug? Okay, the patient is not able to read systemic antibiotics. How the local application of antibiotics can be done? Okay, it's all done. You need to go for the surgical procedure. What has to be done? So all you need to you need to play with all these things, because we have brains. We have brains and we have to use them. Okay, I'm done for now. I think this session is an informative session, and I hope the suggestions what I have given before the session and what I have given after the session, and I want each and everyone to include these in your daily preparation pattern so that it will create a greater impact on your success. Okay, so application is very, very important to be professionally fit in your life. Stay positive, stay at home. All the best and take care. Signing off, Dr. Srikanth from Team MDS Conquer. Love you all, guys.